Hi, my name is Bronwyn, and I am a student midwife, and today I'd like to talk about mood disorders, especially as they affect pregnancy. So let's talk about a hypothetical scenario. Let's say that you start feeling sick, and you are warm to the touch, and maybe you have some body aches, and it's really difficult for you to regulate your temperature. You feel chilled, and then you feel hot, and you don't have much of an appetite, and you have no energy, and this goes on for a few days. So at that point, you go to your doctor, and your doctor says, you have a fever. That's your diagnosis. You have a fever, and take these fever reducers and take them at regular intervals and make sure that you stay on top of that, otherwise the fever will come back. What's odd about that scenario? Is the fever the problem, or is the fever the sign of something else? Now, hopefully, if you go to a doctor with those set of symptoms, your doctor is going to look for the underlying infection that's causing the fever. And hopefully that doctor has an appreciation that the fever is the body's way of counteracting the infection, and that it's not a problem in and of itself. But there are so many things that we experience in our lives that are treated as if they are the problem themselves. And one of those things might very well be depression, anxiety, and mood disorders. So according to the Anxiety Depression Association of America, about 18% of the general population experiences this. That's just a little bit less than 1 in 5. And for the pregnant population, it's about 14 to 23%, according to American College of OBGYNs. So what if the experience of having anxiety and depression is a symptom of something deeper, and it's not the issue itself? So my overall philosophy is that physiology comes first. Understand the physiology, understand what the default physiology is, and then look at why you're experiencing something else. Then and only then, in my philosophy, can you begin to say what interventions are going to support physiology. And if you chase things down enough, eventually you come down to either a structural problem or an intake problem. And the structure would be, do you have something that is not the right shape, or it's missing? Are you actually missing an organ? Are you missing a limb? Or was something not formed correctly? And the intake would be not just what we eat, although that's certainly the biggest component. It would be our food, the air we breathe, the things that get absorbed through our skin, any medications. We are taking things into our body all the time. Some of them are nutritive, some of them are toxic, and some of them are neutral. And our body is designed to process the toxins and remove them. And sometimes that process gets overwhelmed. And sometimes it doesn't have all of the substrates that it needs to function correctly. If we're not getting all the nutrients that we need, then some things are going to fall apart along the path. So with the conventional thinking that depression must be an imbalance of your brain chemistry, well, why are your brain chemicals off balance? Chase that back. Which one is being overproduced or which one is being underproduced? And why? Are you not getting the nutrients to make that? Or is there a toxin involved that is preventing something from being formed correctly? Or do you have enough of a nutrient, or is a different nutrient out of balance and interrupting the process? There are lots of steps along the way, and each one of them needs the right amount of the right nutrient. And any of them can be knocked off balance. So look at what intervention you're doing and what it is you're trying to make up for. So it isn't just about brain chemistry. What if, and the example for that is when you have an anti-anxiety or an antidepressant, you don't get a blood test or a screen of some kind to find out what your chemicals are. We don't find out first what your brain chemicals are before we know what we're making up for. You take the medication, and you see how it goes, and then maybe your dosage gets adjusted, but you don't start out knowing what they are to begin with. It's as much art as it is science. So what are the things that we can do that might support that process? This is where the idea that a mood disorder is a sign and not a thing in and of itself comes in. They can have multiple causes, and it's not just what you're taking in. You would have to look at all over your environment and all over your food to see where it might be coming from. But you might also have, are you getting enough exercise? Exercise has been proven to improve symptoms of depression and anxiety. Are your relationships good? A healthy relationship or a toxic relationship can be a huge source of stress or a source of reduction in stress in our lives. And what about rest? What about mindfulness? What if depression is being caused by 5% of 20 things rather than 100% of one thing? And that's where I see the failing of just giving a pill to make it better. The pill assumes that it has one cause. What if it has multiple causes, and maybe they aren't even equally distributed? Maybe it's 5% of one thing and 20% of another. And maybe they're synergistic causes. Now, that sounds like a lot. And it sounds overwhelming to say you have to be your own detective and figure out what might happen, because one of the biggest ways that depression manifests is apathy. You're apathetic about your life. I'm going to link down below to a YouTube channel for a chiropractor named John Bergman, and I like the way that he describes depression. He said the opposite of depression isn't happiness. It's vitality. It's feeling like you have the energy to attack things in life. And it's feeling like you're up to the challenge and you like the challenge. So when you don't have those things and you know that you have a lot of work to do to get there, it can be overwhelming. And that's where I think that the healthy relationships come in. Do you have someone in your life who cares enough about you to walk this path with you? They can't do it for you. But knowing that there's someone out there, hopefully maybe a good healthcare provider who's going to work with you to make the changes necessary, it can make all the difference in the world. And it sounds like a lot, but you're worth it. And the relationships in your life are worth being good relationships. And the outcome is worth it. And your family will benefit from it. As the mother of the child, you may have heard all that matters is a healthy baby. Healthy babies don't stay healthy if their mothers aren't healthy. You are giving your family a gift by making yourself healthy too. You are worth it. Your family is worth it. So I hope this was helpful, and I hope that you can find these resources helpful too. I'm going to link to John Bergman. He has hundreds of videos, and dozens of them are about mood disorders. I'm also going to link to Dr. Kelly Brogan. She is a psychiatrist who works with women, primarily with women, and she used to do the conventional methods of treatment for anxiety and depression, and then saw how much more effective lifestyle changes were. I'm also going to link to basically a blog for someone who went through this process himself and saw how much better off he was by going through and making the necessary lifestyle changes and weaning his way off of antidepressants. So I'm not saying medicine is always bad. Medicine is always an option, but it's not the only option. There are other things that can help, and maybe all of them together are what you need. But you are not limited to just medication. There are so many things out there, and it is worth delving into. So I hope this was helpful, and let's talk again soon.